Each year, nearly 2 million people worldwide are affected by corneal blindness. Today, the current standard of care is receiving donor cornea from deceased patients. But for every 70 people who need this critical tissue, only one person is lucky enough to receive it, and even with those odds, almost 50% fail by year 15, largely due to immune rejection. While medication is often used to prevent this from occurring, these drugs can cause cataracts and glaucoma, which can lead to blindness. A true alternative is available through BioLattice, CorneaClear. We use a polymeric membrane with specialized chemical modifications that can be implanted using the same methods and act just like the real thing. Our sterile manufacturing techniques would sharply reduce both the risk of infection and immune rejection, be cost-effective, and because it can be stored at room temperature, enable greater global access to cornea repair. Everyone deserves reliable and accessible cornea repair treatment. CorneaClear is the simple solution to restore sight for future generations.